All right, let's do this thing, okay? This is video 5. This is the reality of doing clear aligners as a general dentist. So most dentists did not become dentists because they like teeth. I know, shocking, right? Harsh reality is that most dentists actually hate their job. Before we get into why dentists hate their job, let's get into why they actually wanted to be dentists in the first place. Why do people want to be dentists? So 85% of dentists want to be dentists because they actually want to help people. They also want to make good money. They want to have flexible schedules, live a good life. Fun fact, people aren't actually obsessed about teeth. Being a dentist is more than just about taking care of someone's oral health. When you're a dentist, you get to help people improve their life, increase their confidence, improve their health, and make an impact. So I'm gonna tell you a story about why I wanted to be a dentist. Growing up, I was always the tallest kid in school, and I genuinely thought that I was gonna go to the NBA because I loved playing basketball. The thing is once I hit high school, I stopped growing, and I went from being the tallest kid in school to one of the shortest kids in school. So that forced me to now look and think about what I was gonna do that was actually gonna use my brain instead of my body. I was always good at math and science. So what I did is I started to look up different careers that were kind of focused on math and science, and that put me into the category of medicine. I also wanted to help people, so I knew that I wanted to either be a dentist or be like a sports medicine doctor. And so the summer of junior year of high school, I actually went up to go shadow my uncle who's a dentist. And I spent a little bit of time with him and I watched how he worked, and I actually realized that I genuinely liked how he was living his life. What I mean by that is he was able to do something that really wowed me. He was able to help people. He was also able to have time in his life to spend with his family and to do the things that he enjoyed, like golfing and traveling. And he was also making money. So those 3 pillars were very attractive to me: helping people, making money, and having time in your life. So he actually had a dinner party at his house while I was shadowing him, and his friend was at the party, and his friend was a neurosurgeon. Now, I was talking to the neurosurgeon, and my uncle was having a great time hanging out, just literally having a great time at this dinner party. So I was talking to the neurosurgeon, and he was asking me what I wanted to do with my career. And so I told him, hey, I'm thinking about being a dentist. Seems pretty cool. I also, part of me wants to, go be like a sports medicine doctor. And so he told me that I have to choose. Either I'm going to dental school or I go to medical school. And so I looked around in the room that time and I saw my uncle having a grand old time, and the neurosurgeon was actually on call. And it was at that moment that I decided that I wanted to go to dental school to be a dentist, because honestly, the lifestyle just looked better. It was 4 years in dental school compared to 8 in medical school if you don't specialize. And then I realized that I wanted to get out, help people, make money, and have an impact. So that's what I did. I focused, I studied, I got into dental school, and I became a dentist. And that is why I became a dentist. Your story as to why you want to be a dentist might be similar, or maybe you like teeth, but I can guarantee you people become dentists because they want to help other people improve their life, and sometimes it's just as simple as that. So that's the dream of being a dentist, right? But the harsh reality is the following. You're doing monotonous work, you aren't getting paid well, and you have to do a high number of strenuous, very precise types of treatment, like fillings and crowns and root canals, to maybe make what, $175,000? So unless you've committed to doing high-end dentistry or offer expanded procedures, you really aren't living the life that you dreamed of as a dentist, are you? So why is that? Well, dental insurance fees actually suck if you're just doing the basic procedures like I told you, which are fillings, crowns, and root canals. The fees on these procedures from insurance companies have not changed in over 20 years. Think about that. Most dentists like yourself, they come out of school, they're ready to conquer the world, and they're met with harsh reality. And that's by doing basic, boring procedures that don't pay well. So what are you gonna do? A solution is the level up or die mindset. You need to learn how to provide quality patient care while doing procedures that are going to make you money and free up your time. Things like veneers, implants, aligners. Those procedures are what's really going to change the way that you practice and give you more of the freedom that you're looking for. So what are some of the benefits of offering veneers, implants, and aligners? With all 3 of these procedures, you are going to have much higher fees associated with them when you compare them to the basic procedures like fillings, crowns, and root canals. Insurance can't dictate how much you charge for those procedures either. You basically get paid what you deserve for the work that you do, unlike the rest of those procedures that I mentioned. So when you offer these procedures and you really learn how to do them, this is a step in the direction of your freedom as a practitioner. Now, these procedures aren't that easy to learn right off the bat, but if you take the time and invest in yourself and invest in the education to offer them, you're going to be rewarded on the back end because you're going to get paid more for these procedures. Not to mention, you're going to feel really good about the work that you do and how you're helping all your patients. That feeling alone is so rewarding and worth it. So if you want to start freeing yourself from insurance reimbursement rates, start offering expanded procedures like veneers, aligners, or implants, and do a lot of them. It's the easiest way for financial and time freedom. You may even start liking your job again. All right, so let's talk about why I personally like doing aligners over veneers and implants. First off, there's less appointments. I talk to my patients while they're getting their hygiene exam, and I close the case right then and there. My assistant scans and they take photos, which are all the records that you need. Then once the records are taken, I get to look at the case on a computer and I set it up and I make my modifications that I see fit. The case is accepted, the aligners get mailed in, and then my assistant sees the patient at that first appointment, and then they place the attachments. After that, I go in and I pretty much polish the excess, and then I do any IPR if necessary. The monitoring schedule is every 6 to 8 weeks. Then you get the patient back in for their final appointment. We assess their bite, we check their contacts, we make sure everything is aligned and in place. If everything looks good, then they get a scan, and then we schedule them to come back for their next appointment, where we remove all their attachments and we give them their retainers. Most cases that I do take about 6 to 8 months, so that's about 5 appointments with around 3 hours of chair time. We charge around $5,000 a case, so that's around $1,670 an hour in production. Another reason why I like aligners over implants and veneers is that it takes less chair time. I'm not actually in the chair every time the patient comes into the office. When the patient is in getting their checkups or getting their attachments placed, I'm usually seeing other patients and I just pop in to say hello, see how they're doing. I motivate them to continue to wear their aligners, and then if they need any slight touch-ups, meaning their attachments fell off, I polish some of the excess and they're good to go. Another reason why I love doing aligners is because it's less physical work on my body. Once I learned how to do every step in the entire procedure, I taught my entire team how to do it. I empowered them to do something that was more than just suctioning spit and setting up rooms. My team gets to use their hands and actually make a difference with these patients and form a different connection. This in itself is exciting for them. It's a win-win for everybody. When you give more responsibility to your team, they feel more involved and they tend to buy in a lot easier. They look to this as a challenge, and sometimes a challenge at work is fun because it actually motivates you to do something more than what you normally do. Another reason why I like doing aligners is because it's not as technique sensitive as some of the other procedures in dentistry. Something to compare it to is implants. Implants, for the most part, are pretty simple once you know how to do it, but the learning curve on them, it can be very steep. Something that I'm not the biggest fan of about veneers is the types of patients that veneers attract. You can ask any aesthetic dentist out there that offers veneers, and they will say one of the downfalls of offering that procedure is the types of patients that they get. I'm talking about those patients that tell you the color and shade does not match when in fact it does. It's just the fact that they are staring at their tooth about 2 millimeters away from a mirror and shining all sorts of light on it to prove to you why it's not the same color. This stuff drives dentists insane. So I applaud every aesthetic dentist that's out there that has to deal with this on the regular. So there you have it. You want more freedom as a dentist? Offer expanded procedures. My favorite are aligners. Comment below with what's yours. If you're still interested and you want to hear more about this stuff, go ahead and check out the next video. I put together this clear aligner series just for you guys. You can also follow me on Instagram at dr.avi. I share clear aligner tips all the time, as well as daily motivation videos. Also, if you're interested in getting started with learning how to do aligners, be sure to check out my free masterclass. I walk you through step by step how to start 3 more clear aligner cases tomorrow. The link for that is in the description below. My goal is to give as much valuable information as possible with fellow dentists so that we can all be better. Thanks again for watching. I'll see you again in the next video.